new Plan G that we're coming out with. It's already approved in a bunch of states, and I'll go over that here in a second. I'm going to go over the rates. I'm also going to go over our telephonic and our new Express application, guys. So there's new ways to turn in business with Equitable. You might not have written anything with us for a while because some of our Plan F rates were going up. Still a very low rate increase. I think we only had about a 4 or 5% across most states. But we are rolling out this new Plan G, and hopefully we will continue to have that low rate increase with this, and you guys will have a product to write for years to come. So, guys, my name's Todd Weiss. I'm one of the marketing directors for Equitable, and I've been selling Equitable med subs and their other products for about 8 years now. So I helped design this webinar as an agent to help you guys as agents. So we always try to look at things here at Equitable from an agent perspective. So if you guys have any questions as we go, feel free to type those in. We get a lot of people on this webinar, so we might not be able to answer all questions. So I will try to follow up with you guys after this webinar, and I will send everybody a link because we created a web page just dedicated just to this Plan G, so you can look at the rates and look at maps. So I will follow up with everybody after this webinar sometime today. I'll shoot you a quick email. I'll send you the link. If you guys need supplies or anything else, just let me know, and I'll gladly work with you. So let's get to this, guys. Okay, so about Equitable, a lot of you guys are probably been with us for a long time, but I'm sure some of you guys are new. You know, Equitable has been around since 1935. You know, it's a family-owned business. Rod Ross owns it right now, and I've met him numerous times. And I think his great-great-grandfather started the company way back in the day. So it's always been a family-owned company, and they do a real good job with customer service and everything they do. So it's just a really down-to-earth company, real good to work with. You know, I love it because if you ever call us up, you always talk to a human being. You never talk to robots. You never talk to answering machines. If your client needs to call us up, you need to call us up, you talk to a human. And that's the way the company was started way back in the day. We still want to have that. So I think, you know, we lead the way in customer service across the insurance industry. You know, another thing about Equitable, which is really nice, is we do have a bunch of different products. We have our new life insurance. We have this Plan G Med Sup. We have a cancer plan. We've got a hospital indemnity plan. So no matter what type of insurance you're meeting with seniors on, we do have a product to fill those holes. So if you guys need information on any other product, you know, once again, we can help you out with that. So here are all the states that we filed the Plan G in. All the blue states are approved, and we can take business right now. Like some states like Texas, it's approved, but we're just waiting to test some back-end things in our system to make sure that everything works before we let you guys write the product. So all the blue states you could write in right now. There's 2 or 3 other states that got approved over the last week. Like I said, we still got to work on some back-end things. So definitely, guys, if you're in one of those other states, keep on checking your email, because that's how we get a hold of you guys. We'll email you and say, Texas is now accepting business on X day. So pay attention to that, because we will shoot that out to you guys and let you guys know as soon as we can so you guys can write business. So why should you guys offer the Plan G? You know, why sell it, where it fits. I'm going to compare it to a Plan F. I'm going to give you guys sales ideas. I'm going to go over rates. Not every state, but most of them. And once again, I'll send everybody a link at the end of this webinar so you guys can go to this landing page and check out the different maps and the rates for all the states. And I want to talk a little bit about our telephonic app and our e-app. So if you guys haven't done that process yet, it's really easy. I did it earlier today, and it's the easiest process out there. So why sell the Plan G? I mean, there's a lot of benefits for you and for the client. So most of you guys probably know this, but the Plan F and the Plan G are almost identical. The only thing that's different is that Part B deductible. And that deductible right now is $147. So the 2 plans, if the client pays that Part B deductible themselves, well, then the plans are equal. And there are talks, I'm not saying it's going to be law or anything, but I have seen things proposed that by 2020, they want to get rid of 100% coverage plans. The government wants people to put in some co-payments or some deductibles. So by 2020, the Plan G might be your full coverage plan. That Part B deductible, the Plan F, might go away. I'm not saying it will, but I've read some things, and it looks like that might be what we're going to. So I'm starting to sell the G more the last couple years now, just in case that is true. It's a bigger savings for the client. It's a little bit more stable. So I think the clients like it. Actually, I helped a lady out with the G this morning. So the only difference between the F and the G is that Part B deductible. This product is level commissions years 1 through 6. So it's really good for you guys. We give a 12-month advance for everybody. You know, this market right now is insane. Like the baby boomers is a huge generation, and you know, these people are coming off work plans and group plans, so they have a $1,000 deductible or $2,000 deductible. So coming in and showing them this plan with a $147 deductible, that's not bad at all. So guys, here's a little graph we put together. You know, right now, you know, there's about 40 million seniors. You know, by the time the baby boomer generation ends, it's going to be close to 70, 75 million seniors. Like, it's almost going to double over the next 20 years. And by 2040, it's definitely going to double. So it's just a great market to be in. There's so many people that are turning 65. It's a great opportunity for you guys as agents. And I think this Plan G is going to be good. And it looks like we keep on having more people trying to attend, but we've reached our max. We also have a 7% household discount. All those stars there are where we have discount states. Not every state would allow us to have the discount. Look at the red states first of all. If you see at the bottom it says states offering 7% household discount, only one person needs to apply. So, sorry about that, guys. So all those red states, only one person needs to apply. Excuse me 1 second. There we go. All the other states that have a star, 2 people need to apply to get the discount. And let's say a guy applies today, you know, and the wife doesn't turn 65 for 3 months from now. Well, when the wife gets on it 3 months from now, that is when the wife will get, and the husband, then when they both get the 7%. You know, we're trying to get it in each state to go to the one person, but it's not an easy task. So I don't know if that's going to happen or not, but we are definitely trying to get it so one person needs to apply. So in those 5 states, it's 1. The other states, most people have to apply to get the discount. Now, where does the Plan G fit? You know, I think it's really good people are in good health, because sometimes they might not even meet that Part B deductible. And that lady I helped her out with today, she goes to the doctor once a year, if that. You know, so if she went, she wouldn't have to pay much of that deductible at all, maybe like 30 or 50 bucks of it, so she'd save even more money. People that have a Plan F, guys, Plan F have a higher rate increase history than the Plan G does, and I'll kind of go over this later, but when people are leaving a group plan, or maybe their Medicare Advantage plan leaves the market, clients have certain guaranteed issue rights. Well, you can't go to a Plan G during those time periods. The Plan F you can go to, but the G you can't. So that means there's less people with bad health, it's more underwriting. So the more underwriting we have, the more stable the rates are going to be. And that's across all companies. That's not just with us. So the Fs are going up, the G's are more stable, so I think people are really going to like this G. Some people are not satisfied with the N. You know, I had some healthy people that I put them on a Plan N, and they got sick, and, you know, for a month or 2, they were seeing the doctor a lot, and they're like, you know what, I didn't like dishing out 20 bucks every time I saw a doctor. It was nothing major, so they were still healthy enough. So I put some of this bill back on the Plan G just because they're like, I'll pay the $147. But I just don't want to pay the 20 bucks every time I see a doctor. You know, all those baby boomers, like I said, that are right now paying work plans. You know, like my parents, they're 63 each, paying about $425 a month for their insurance, plus deductibles, plus co-payments. You show them this plan, you know, it's pretty cheap. All you got to do is pay $147 once a year, you're good. So I definitely think those people new to Medicare will like the Plan G. Maybe people that have a high deductible F, you know, they might like the Plan G. So I want to go over kind of how I sell the Plan G, and hopefully this makes sense to everybody here. So I pulled this in Nebraska. This is a female, age 65, Omaha Insurance Company, $130.26. If you times that by 12, that's $1,587.12. The Equitable Plan G in that same area is $90.99. Now, I did include a discount for both companies. So Mutual of Omaha has a 12% discount, which is included. Equitable has a 7% discount, which is included. So that does include the discount. So there's a pretty big difference there. So if you take the Plan F price minus Equitable's Plan G price, there's a difference of $495.24. If the client, let's just assume that the client is going to go to the doctor, they're going to pay the $147, well, they still save $384.24. So I'll do the math like this sometimes in front of the client so that they have a visual, they can see this. So I always try to bring a notepad with me. Sometimes I even take this to the extreme. I might take it 384. I say, hey, you're going to have this for at least 5 years, so let's times that by 5. Then they're like, wow, that's a lot of money to save. I'm like, it's the same thing if you're just self-insuring your 147 deductible. So if you break it down like this, I think clients understand it, and they will definitely follow whatever you guys sell. So if you guys are confident in it, I think the clients will be also, and it's really good for the client. I mean, some examples I could find are going to be $400 or $500 difference between the F and the G, sometimes between the same company. So it's just the way it's priced. I think that G is a really good way to go. So once again, guys, it's all about the numbers. You know, $147 divided by 12, $12.25. So if the plan F is more than $12.25, consider the G. You know, sometimes maybe some guy or girl got on a plan F, and it's gone up, and maybe your plan F is only $5 to $10 cheaper than them. Well, they might not want to change for $5 or $10 from an F to an F. You take an F to a G, it could be 20, 30, 40 bucks a month savings. Then once again, guys, if you explain why the Plan G premium should remain more competitive throughout the years, you know, maybe you have the buyer's guide with you. You know, I think it's called the 2015 buyer's guide. It talks about the guaranteed issue rights. You know, so if you have that book with you, you can show them in that book, hey, you cannot go to the Plan G in guaranteed issue situations. Therefore, your rate will be a lot more stable. So I always use tools like that when I'm on a meeting with my clients. So definitely that book, you can download that, or you can order that from Equitable. We can get you some of those. So a lot of people are probably on this call to say, hey, just show me the rates. I want to know what this thing is going to cost. So I didn't pick every state. I picked, I think, 7 or 8 states here to kind of go over with you guys. But once again, I can send a link out as soon as this thing is done. And we create a special Plan G page that will go over a map and show you the different zip codes, the different area factors for every single state. And we'll also show you the rates for all ages. So I will email everybody after this call. So let's look at Illinois here. Equitable Plan G, 101.46. We have that household discount onto it. We're down to 94.36. You know, and ours is a brand new rate. Mutual came out in 2013. So if you guys have been in the MedSup business a while, you probably know that every 12 to 16 months is usually when a company has a rate increase. So it's been a while for Mutual, so they'll probably be going up there. So we got Iowa here. Iowa's a good state. That might be our best state last year for Equitable. It comes in 84.02, right there with Mutual, only a few pennies off. You have that discount on, drops down to 78.14. You know, once again, Mutual came out 2013. Ours is 2015. We're pending in Kansas, but 99.97 should be a real good rate in Kansas there. And once again, guys, maybe I didn't tell you this, but you can see at the bottom there, it says rates based on female, age 67, non-tobacco, and it's usually the lowest area factor of each state there. So this is, we do age 67. We did block our rates from ages 65 to 67 because we don't want all of the open enrollment business. I mean, we'll take some, but we want to underwrite as much of our business as possible. That's why we had, I think, a 4 to 5% rate increase on average across every single state on our Plan F. And that's been our rate increase history. So we're not like companies that come in at a really low rate and have a 15, 20% rate increase. We put checks and balances in place to keep our rates stable for a long time. So, you know, if we could come in with a really low rate, but then everyone would be dumping all their turning 65 business to us, and people could be really unhealthy and have a whole lot of claims, nothing we can do about it. So our rates are competitive at 65, but we really, if we get underwritten business, guys, that's really going to help us out and you out, because as an agent, I hate having to change my business every couple years. So you put them with Equitable, put them on this Plan G, you guys can keep them on the books for 5 years, 10 years, and make commission off that for a long time. So Kentucky, real good rates. Kentucky, 88.03 after the household discount. Mississippi, 91.47. That one's pending, but once again, we have the discount there, down to 85.07. Nebraska, 97.84. With that discount, 90.99. We have real good rates in Nebraska, and once again, that rate came out in 4.1. Some of the other companies in 14, so we're going to be real good in Nebraska. Pennsylvania, 104.23, and that's age 67. We don't have a discount there, but it's a really good rate. So guys, I want to go over a couple things now about how to submit applications with us. So we do have the telephonic application. Now, if you guys haven't used this yet, I use it all the time. I use it a ton because it's been out the longest. I just started doing the online app, but I really like this telephonic app because it's not a drug screen or it's not a pre-qualification call. Guys, it's a total application that's complete and full over the phone. You know, there's no paper unless you need to have a replacement form signed. It is very simple underwriting, guys. It's a yes/no answer. If it's open enrollment or guaranteed issue, it's about 15 minutes. It's about an extra 5 minutes if we have to go over the health questions. So let me explain how this process works. I love this, guys. If you guys never done it before, try it once. You'll be hooked. You can do this whether you're kitchen table selling or three-way phone call center, whatever. I do all my sales. Well, I'd probably say 75% of my sales are kitchen table. I like to meet my clients face-to-face. So let's say you go meet somebody. You show them Plan G. The client likes it. Let's call her Mrs. Smith. And Mrs. Smith really likes this Plan G. You think she passed the health questions. You're okay. Well, Mrs. Smith, I think you're healthy enough, but what we can do is we can call up underwriting right now and get a yes or a no on your policy. So I'll give you the number later, but you call up underwriting. I'm like, hey, my name's Todd Weiss. I'm an agent. I'm in Missouri. They're going to go, okay, what's your writing number? You know, what city you're in? Who are you doing this on? It's on Mrs. Smith. It's Betty Smith. Okay, what day do you guys want as a effective date of your policy? I'm like, Mrs. Smith, she gets approved. We like to do a May 1st effective date, and then they usually ask you when do they want the bank draft? Do you want to draft it right away, or do you want to do it upon approval? You know, let's just say, well, she gets paid at the end of the month, so let's go ahead and draft on May 1st. So the underwriter goes, okay, now Todd, please pass the phone to Betty Smith. So I usually use my cell phone, guys. I'll tell you why here in a second. So I give my cell phone to Betty Smith, and what happens is the underwriter has the application pulled up on their computer screen. So if it's on the app, the underwriter will ask that to your client. So the underwriter is going to go out, start out and say, okay, Betty Smith, is that B-E-T-T-Y, S-M-I-T-H, yes. Okay, Betty, what's your address? What's your phone number? Betty, what's your Medicare number? When did you get on Medicare Part A? When did you get on Medicare Part B? Betty, what's your prior insurance? If it's on the application, guys, they will go over it with you. So then they will ask the client all their health questions. Then they're going to say, okay, what medicines do you take? What's the dosage on those medicines? Can we please do a prescription check while you're on the phone to verify this? They say yes. They plug in the system. 30 seconds later, Equitable will have an answer. And if everything matches up between what the client told them and that RX check that we use through Millman, if everything is a green light, they'll continue. If something comes up, the underwriter might say, well, Betty, I see a prescription here you didn't give me. Well, my doctor prescribed that. You know, we took it once, and they said didn't need to take it again, so I've been taking that medicine for 2 years. Then they'll update the system. So sometimes they might come back and ask a couple questions if something comes up different. Then if they get to the banking information, you know the client's approved. So Betty Smith now will give them her banking information, and then they'll ask again, can we draft this right away, or do you want to have this drafted on May 1st? She'll say May 1st. Then she can say, okay, Betty, give the phone back to Todd. Then she gives the phone back to me. Now, this is why I use my cell phone. I put it on speakerphone right now because I know she's approved because she took the banking information. If she's not going to get approved, they would have stopped the interview right then and there. So the phone comes back to me. I put it on speakerphone, and the underwriter goes, Todd, Mrs. Smith is approved. She's policy number 12345, and we're going to start this policy May 1st. I'll be like, thank you very much. Have a good day. So we hang up the phone with underwriting. So the client is approved. We have a policy number. Then I help Mrs. Smith cancel her old policy. Now, since I'm there at the kitchen table, I will take a replacement notice. I will fill it out right then and there. And then when I get back to my office, I will either fax it in or I'll mail that replacement notice to Equitable. And that's the only thing you need to do. Now, you guys can also do this in a three-way phone call. I live in Kansas City, and I sell all over Kansas and all over Missouri. I've got some clients in St. Louis, and I remember a while ago they had a different company, and it went up, and I'm like, okay, called her up. I'm like, Mrs. Smith, I have the exact same thing with Equitable here. You have the Plan F, but I can get you that Plan F for, $30 a month savings, same plan, just a different company, and we can do this over the phone. So instead of me driving 3.5, 4 hours out there, meeting for a couple hours, then driving home, did a 3-way phone call. I talked to her first, went over the health questions, make sure she was healthy. Okay, Mrs. Smith, hold on. Let me call up underwriting, and I'll patch you in just a second. So I call up underwriting. I give them my agent information first. I say, put Mrs. Smith on the line. I connect us as a 3-way phone call. I'm like, Betty, this is Tamara. She's going to finish the interview with you. I'm just going to sit back and listen. Then I hear everything that's going to happen, and then at the end, the underwriter goes, okay, Todd, you still there? I'm like, yes, I am. Okay, Todd, Mrs. Smith is approved. Here's her policy number. I'm like, thank you very much. So the whole process can be done as a 3-way phone call. You just listen the whole time. The only thing is, you cannot coach your client. If they hear you coaching them or talking to them at all during the health questions or the medicine, they're going to terminate that phone call. So you need to make sure that you, anytime you call them up, you prep your client beforehand. Just say, hey, we went over the health questions. They're just going to ask you, just say yes or no when they ask you those questions. So that is a telephonic application in a nutshell. I've been doing that process for 3 to 4 years now, and I really like it. It saves me a lot of time because I don't know about you guys, but I've written products for other companies before, submit the business in. A week goes by, hear nothing. Another week goes by, hear nothing. Client calls me up. Well, am I approved or not? I don't know. Am I going to cancel my old one? I'm like, well, I don't know yet. Another week goes by, I don't hear anything. Then the client calls me up and says, you know what? It's been a month. I don't have an answer yet. I'm just going to stick with my old company. I'm like, dang it. If I could have gotten an answer sooner, I would have had a Medicare supplement sale, but I didn't. So that's why I love this process, because you get an answer yes or no right away. So it's a really easy process. I've never had anybody cancel this policy after I got them approved over the phone and helped them cancel their old policy. Everything's done. They're like, sweet, you did everything for me. You canceled my old policy. My new one's in effect. In about 2 weeks, I'll be looking to get my ID cards. So it's a great process. If you guys have any more questions, shoot me an email. I'll have my email up here in a bit. And like I said, I see some questions coming through. We're going to try to answer those, but if we don't get to all of them, I will follow up with everybody at the end of this webinar. So we have a second thing that we just came out with about a month ago. It's called electronic application. And the way this works is you go to our website, www.equiline.com. You go to the support tab and click Online Express. So let me kind of show you that. So this is kind of the background, the home page. You go to support, see what the big arrow is? Online Express app. Just click that. Then it brings up this page. Start application. Only thing on that page. Then you pick which state you want to sell in. I have a license in 20, 30 states, so it lists every single state I can sell a policy in. Then I picked Missouri because that's where I am. This is the application, guys. So once again, you fill out everything on this thing except the health questions, the banking information, and the medicine. But you fill everything else out. So it starts out here. Application date. What's the gender? What plan? Is it open enrollment? Did I meet the applicant in person? Did I do it over the phone? So I actually had a referral I did this morning, and I had her on the phone with me, had her on speakerphone, so I just typed all this information up. I took me about 5-10 minutes, talked to her beforehand, went through the health questions, read the important statements to her, and she goes, yeah, I want to do it. I'm like, perfect. So I just had her on speakerphone, and she just gave me the information, and I typed the list up as we went. It probably took 5-10 minutes because we were talking, telling stories, building a rapport back and forth, but it didn't take very long. So the next part is their social and their Medicare number. So you got to make sure your clients are willing to give you that over the phone. So I just filled all that out. Then the next part is, are you covered by Medicare Part A and Part B? So pretty much, guys, this is a paper app. It's just all online. You just fill it out as you go through. Then this is your certification to do it. So you put your email in there, and you put your name and click submit. Then that's it. Within 24 hours, your client will be called and to go over the health questions and the banking information. When they get approved, and hopefully they get approved, you will receive an email with your policy number and the result. So I need to check my email. I did it about an hour or so ago, so I haven't got an email yet. But by the end of this webinar, I might have an email saying, hey, your client was approved. Here's your policy number. And that even has the replacement notice, guys. So you don't have to do any paper at all with the online. With the telephonic one, you have to still sign the replacement notice. However, with the online app, you don't need to do anything. It's fast and easy. So guys, you can submit applications anyway, through the telephone, through the electronic version. You could fax them in, which that is not our fax number. I will get you the correct fax number there, or you can mail it in. So let's recap here. So guys, the only difference between the F and the G is a Part B deductible. You know, if you look at the price, sometimes it could be $300, $400, $500, maybe even $1,000 a year between the F and the G, as long as they pay that $147. And then third, consider the future. You know, if you go over the guaranteed issue rights and why people can't get on the G if they're leaving a work plan or they're moving at a Medicare Advantage area, that stability, I think, is what will sell it. And that's what sold my client this morning. You know, she was looking at the F, but it was literally on the Equitable F to the G, it was about $35 a month difference. And I'm like, you're healthy. You go to the doctor once every year, maybe every other year. It just makes more sense and it's more stable. She's like, okay, let's do it. So guys, I think the G is going to be a real good thing. Now guys, we do have a final expense called a Heritage Protector. We have an EchoCash, which is a hospital indemnity plan that fills the gaps of Medicare Advantage. And we have a cancer plan. You know, I sell all these products. I think they're all great. I mean, everyone knows someone that's came through that's had cancer. You know, I'm not a huge fan of Medicare Advantage, but people like it, and some people need it, and they can't afford a Medicare supplement. So we have this product called EchoCash to help fill in the gaps. And then everyone's going to pass away at some point in time, so the EchoCash or the Heritage Protector is definitely a great product. If you guys have questions about any of those products, I'd be happy to help you guys out also. Bill Ellsworth, VP here, but he was out today, so I'm doing this. I'm the marketing director for Equitable. And I didn't realize that they didn't change the numbers on this, so I'll check on these phone numbers here. But I will email everybody after this webinar to get you some correct information. We have a landing page we built just for the Plan G that has all the rates on that page and all the maps. So I will send that to you guys. If you guys need supplies, you can go to the website, www.equiline.com, and fill out supply orders there. You can also shoot me an email, and I will order supplies for you. Any product, doesn't matter. We can definitely help you out with that. And like I said, I will follow up with everybody on this call because I know people are asking questions, and there's a lot of them coming through, so we probably won't get to all of them. So we'll follow up a generic email to everybody, and there's stuff you guys need. We'll just talk back and forth via email today. So guys, thanks for joining us. I think this is a great product, and once again, you want to copy the slides or anything, I'll get those to you. So be on the lookout for emails from us that will tell you when you can sell in your state.